Okay, hello. Dr. Herman again, and this is Paul Mack.
Right.
And Paul lives down here in South Florida.
All my life.
All your life. How old are you, Paul?
57.
57. And you work in a building,
I
and
work in a condominium in Avenger,
Okay.
building maintenance.
there's a lot of labor on the back and a lot of stress on the
Dog
back.
walk.
Yeah. You have, Paul entered our office for a non-surgical spinal stenosis pain relief program, and your pain was in the low back and
Lower back, both legs, pain in the shin, pain in the groin area, tingling, numbness,
burning pain too.
burning pain, shooting pain down, running pain down the legs.
On a scale of 1 to 10, if 10 was the worst pain when I first met you, how would you rate yourself back then?
I was 10 plus.
10 plus.
Yeah.
And you tried what kinds of remedies prior to coming here?
I've had the epidurals. I've tried 3 sets of epidurals, 3 different shots of 3s. I've had different chiropractor care. I've had different pain management care, numerous pain medications. So far, nothing has ever helped until I walked in your doors.
Okay. And this is not a paid testimonial,
No.
but you.
I have paid. I'm not getting paid.
Yeah. Okay.
But,
Now your MRI that we got to study, which is pretty recent, and every description at every level, from lumbar 1 through lumbar 5, was severe.
Right.
And we're looking at, and I can let all the viewers know, severe was literally there was barely any space for the spinal cord and the spine on the MRI. It's evident how much arthritis had built around his spinal cord and around the nerves. So your pain was a 24-hour day, 7-day-a-week thing.
Constant.
How many years were you dealing with the pain?
I'd probably say it's been since the late 80s.
Since the late 80s.
Right.
So we're talking 20 years probably of pain.
Right.
Yeah. And unbearable pain.
It was at times, yes.
Yeah.
Very.
And coming here now, and since you were a 10 plus when I first met you, what would you say sitting in front of me right now?
Right now, I'm probably at a 1 or a 2.
A 1 or a 2?
My drastic notice is in my shins, where I had a lot of burning and a burning, tingling feeling all the time.
Yeah.
Now it's almost non-existent. Occasionally, I get a little bit of flare-up. I had about 6 weeks worth of care, and then I had to take a week off. And during that week off, I did not have any attention. Upon returning back to South Florida and getting back into the care, I have been back now beyond where I was at that point.
Yeah. And you're back in care now. What is it, about 2 weeks ago you started back up again?
It's been 3 weeks now.
3 weeks now. And we've been doing with the decompression, the oxygen therapy, and the active therapeutic movements.
Correct.
With you, the ATM2 machine. And almost immediately after you started, it was within a day or two, you noticed
You started feeling a big difference.
you're almost 100% pain relief.
Correct.
And your diagnosis is severe spinal stenosis.
Correct.
So let the viewers know, because, All right, so right now, and we still have a way to go. We're not
No.
through with the program, so we've got work to do. But you're already from a 10 plus, you're down to a 1 or 2,
Right.
which is amazing, and you've done it all before.
Yes.
Okay.
Been
All right.
through the gamut.
All right. Well, I want to thank you, Paul, for sharing your story with other people, and maybe if somebody wants to call on you, but we'll keep your number private. But hopefully, maybe somebody will see your video, or they'll get to bump into you and ask a question.
All I can tell them is that if they're in pain, come to see you. All you can do is try to help them.
Yep. And it's working though.
So far, it's helped me.
All right. Thanks, Paul.